Good day, everyone. I am Dr. Sumiya Fanlo, and thank you for joining us in this brief but important discussion on HIV and pre exposure prophylaxis, or PrEP. As a medical professional, we understand how crucial awareness and prevention are in the fight against HIV. Despite advances in treatment, HIV remains a significant public health concern, especially in high risk population. Today's goal is to provide clear and concise and practical information about HIV and how PrEP can be used to prevent it. I am joined by two highly qualified colleagues, Dr. Kitty Redula, who will give a quick overview of HIV, and Dr. Thomas Tan, who will explain how PrEP works and why it matters. Let's get started with Dr. Redula.
Thank you, Doc Sumiya. HIV, or the human immunodeficiency virus, is a virus that attacks the immune system, particularly the CD4 T cells. These are the cells which help our bodies fight infections. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome. HIV is transmitted through unprotected sexual contact, sharing of needles, or through mother to child through childbirth or breastfeeding. The good news is that HIV is preventable and manageable. With early diagnosis and treatment, people with HIV can live long, healthy lives. But the real game changer is what you call the PrEP, or the pre exposure prophylaxis, which Dr. Thomas Vincent will be discussing.
Thank you, Dr. Redula. So, is it true that there is a medication that can actually prevent someone from getting HIV? Yes, we call them our pre exposure prophylaxis or our PrEP for short. So, it comes from the word pre, meaning before, exposure, or those are the activities that can lead to an HIV infection, and prophylaxis, meaning prevention. So, PrEP is the use of antiretrovirals by people who are HIV negative to prevent acquisition of HIV before exposure to the virus. So we need to get our baseline labs, including our creatinine, our HbS-AG, and our baseline HIV screening. So the eligibility for PrEP would include those who are HIV negative, and of course, with normal kidney functions, and those who are very willing to use PrEP as prescribed. Patients must also be free from any allergy or any contraindication to our PrEP medicine. So dosing regimens for oral prep would include daily regimens and those event-driven regimen. So prep uh, works when taken regularly. Prep reaches its maximum effectiveness after 7 days daily doses, and prep does not prevent other sexually transmitted infections other than HIV. And prep also does not prevent pregnancy, and prep is safe. So some questions would include: can you use PrEP and oral contraception together? Yes, there will be no interaction between the two. Another question is: if I take PrEP, can I stop using condoms when I have sex? Of course not. PrEP works best as part of a combination approach. It does not prevent sexually transmitted infections or unwanted pregnancies. Does PrEP have side effects? Yes, so the most common side effects would include headache, nausea, vomiting, rash, and loss of appetite. So for most people, this will just go away after a few weeks. Can I share PrEP with my HIV positive partner or take my partner's HIV medications to help prevent HIV? So even if your HIV positive partner is taking your antiretrovirals, it is important not to share your PrEP pills with your HIV positive partner or to take your partner's HIV medication as PrEP. So can you get HIV from taking PrEP? Of course not, you cannot get it. So how often do I need to take PrEP? You need to take it once a day at more or less the same time. So that doesn't mean that taking the pill has to be on the minute. A few hours, either way is okay. So how long does it take for PrEP to become protective? PrEP reaches maximum protection from HIV for receptive anal sex at about 7 days of daily use. For receptive vaginal sex and injection drug use, PrEP reaches maximum protection at about 20 days of daily use. So what happens if you miss a dosage? The rate of protection is directly related to the rate of pill taking. So if you don't take the pill correctly, you don't get your full protection. So if I take PrEP, does this mean I have to take it for the rest of my life? So no, it is important that you take PrEP daily while at risk of acquiring HIV. But when you feel that you are no longer at risk, you can talk to your healthcare provider about stopping PrEP. So that would be all. Let me give you back to Dr. Sumiya Fanlo.
Thank you, Dr. Kitty Redula and Dr. Thomas Tan, for those clear and insightful presentation. To wrap it up, HIV is a serious but preventable virus. Understanding how it's transmitted is a key. PrEP is a powerful tool that can dramatically reduce the risk of acquiring HIV, especially for people at higher risk. When taken correctly and combined with regular medical follow ups, PrEP is a safe and highly effective prevention strategy. As healthcare providers, it is our responsibility to spread awareness, reduce stigma, and empower patients to make informed choices. We hope this brief webinar gave you a valuable overview of HIV prevention through PrEP. Thank you for your time, and we encourage you to share this information with your communities. Stay safe and informed.